Have you ever walked out of your doctor's office feeling completely relieved because your blood pressure was finally normal? Maybe it was 120/78. Maybe your doctor smiled, looked at your chart, and said, "Everything looks great." Most people hear those words and stop worrying. But what if those numbers are only telling half the story? What if your blood pressure is perfectly controlled while your body is quietly sending warning signs you've learned to ignore? Swollen ankles, a strange heaviness in your legs, needing an afternoon nap when you never used to, or feeling like your energy has slowly disappeared over the last few years. Many people assume those changes are simply part of getting older. Sometimes they are, but sometimes they're not. Sometimes they're your body's way of asking a very important question. Is this medication still the best choice for me? That's a question many people never think to ask. Today, I want to show you something that many long-term amlodipine users never hear during a routine appointment. Not because doctors don't care, not because the medication is bad, but because controlling blood pressure and understanding everything happening inside your body are two very different conversations. And before this video ends, I'll tell you about a retired school principal whose life changed after asking her cardiologist just one simple question. That single question led to a completely different treatment plan, and she finally understood why she'd been feeling older for years. I remember meeting a man named Michael. He was 65. He loved gardening. Every morning, he walked nearly 2 miles around his neighborhood. His blood pressure had been beautifully controlled for almost 6 years, and every appointment ended the same way. Keep taking your medication. Everything seemed fine, but slowly, life started changing. He couldn't spend as much time outside. By late afternoon, his legs felt unusually heavy. His shoes became tighter every evening. He stopped taking long walks because he believed he was simply slowing down with age. His family noticed he sat down more often. He laughed it off and said, "I'm getting old." That's a sentence I hear far too often, because aging certainly changes the body. But not every new symptom belongs to aging. Sometimes the medication deserves a closer look too. Months later, Michael finally mentioned these problems during a routine visit. Not because he was worried, but because his wife insisted. That conversation opened the door to tests no one had considered before, and what they found completely changed the direction of his treatment. Stories like Michael's are exactly why we're having this conversation today. Not to scare anyone, not to convince anyone to stop taking medication, but to help you recognize the difference between getting older and ignoring signals your body has been trying to send. For those who don't know me, I've spent years working with adults living with high blood pressure, heart disease, diabetes, and circulation problems. One thing I've learned is this: patients rarely ignore symptoms because they don't care. They ignore them because they believe someone would have warned them if those symptoms mattered. Unfortunately, medicine often focuses on solving today's biggest problem first. If your blood pressure is dangerously high, lowering it is absolutely the priority. And amlodipine is very good at doing exactly that. It has helped millions of people reduce their risk of stroke and heart attack. That's important to recognize. But after years on the same medication, new questions become just as important as the old ones. How is your circulation? How is your heart adapting? Are your kidneys handling everything well? Has your medication remained the best option for your current health? Those questions deserve attention too. So let's quickly understand what amlodipine actually does. Imagine your arteries as highways carrying thousands of cars every minute. When those highways become narrow, traffic slows down. Pressure builds. That's essentially what high blood pressure is. Amlodipine relaxes the muscles inside artery walls. Those highways become wider. Traffic flows more easily. Pressure drops. It's a smart solution. But every solution in medicine comes with trade-offs, and understanding those trade-offs can help you recognize changes earlier. Think about watering a garden. If you suddenly increase the flow from the hose without improving the drainage, some areas begin collecting water. Your circulation can behave in a surprisingly similar way. Blood moves more easily through relaxed arteries, but the veins don't always adjust in the same way. For some people, that imbalance allows fluid to collect in the lower legs. Not because blood is leaking, but because tiny blood vessels begin allowing more fluid to move into nearby tissues. That's why swollen ankles are one of the most recognized side effects of amlodipine. Many people think it's only cosmetic. But here's a better question. Why is your body creating that swelling in the first place? Understanding the reason matters much more than simply accepting the symptom. Your body is often trying to tell you something worth investigating. One of the earliest signs people notice isn't pain. It's inconvenience. Shoes that fit perfectly in the morning suddenly feel tight by dinner. Socks leave deep marks around the ankles. Your feet feel heavy after sitting or standing. These small changes are easy to overlook. Many people blame salt, hot weather, long workdays, or simply getting older. Sometimes those explanations are true. But if these changes started after beginning amlodipine or became gradually worse over several years, they deserve attention instead of being brushed aside. A simple habit can tell you a lot. Look at your ankles at the same time every evening for 1 week. Do they appear larger than they do in the morning? Do both legs swell equally? Or is one noticeably worse? These observations can reveal important patterns. Patterns are incredibly valuable. Doctors can often learn more from 7 days of careful observations than from 30 seconds of looking during an office visit. Keep a small notebook and write down what you notice. It may become one of the most useful conversations you ever have. Here's something fascinating. Many long-term users don't complain about exhaustion. Instead, they describe it differently. I lose my energy around 3 o'clock. I just don't feel like myself anymore. I wake up fine, but by afternoon I'm done. That difference matters. Your heart works continuously, every minute, every hour, every day. Even small changes in circulation can gradually affect how hard your cardiovascular system works throughout the day. That doesn't automatically mean something dangerous is happening, but persistent fatigue deserves investigation, not dismissal. Instead of assuming it's normal aging, begin tracking it. Ask yourself, what time does the fatigue begin? Does it happen every day? Does resting improve it? Does exercise make it worse or better? These details help separate random tiredness from meaningful patterns, and patterns often lead to better medical decisions.